Hey everyone, it's Wednesday, July 9th. I'm Benit Brach here in the CBC Vancouver newsroom. Here's what's happening this afternoon. Well, the BC government is expected to release a report to improve safety at festivals and at large gatherings. This comes after a deadly incident at the Lapu Lapu Festival in Vancouver in April when a man in an SUV drove through a crowd, killing 11 people. Retired BC Supreme Court Chief Justice Christopher Hingston conducted a commission of the inquiry since the tragedy. His report will be reviewed by Cabinet before it's released to the public, and that is expected to come at around 1:30 this afternoon. We will be bringing you that press conference live. And the Eisman Creek wildfire near Lytton is now being held. It's no longer likely to spread, according to the BC Wildfire Service. It says the change is due to significant efforts of firefighters with the help of some favorable weather. That means it will no longer be considered a wildfire of note. That fire sparked up when a wheel fell off an RCMP trailer. The service says staff will stay on site at that wildfire to continue to mop up and patrol and ensure the area remains secure. It is one of about 80 active fires across BC, about 20% of which are classified as burning out of control. And if you are in BC's interior, watch out for heavy rain. A special weather statement is now in effect for the North and South Thompson regions, as well as the Shuswap and West Columbia area. So Environment Canada is advising the potential for heavy rain is high, partly due to thunderstorms that are rolling in. You can see that gray area there. It says to watch out for flash flooding, an increased risk of landslides, and reduced visibility when that rainfall is strong. It is expected to last throughout the night. The Tsleil-Waututh First Nation is proposing a water guardianship program in Burrard Inlet after a 10-year-old boy was killed in a speedboat crash. The mother of Lionel Hall, who died at Kate's Park in North Vancouver last month, says that she supports the First Nations initiative to put patrol members on the water.
We don't want people to stop their children from doing things because of a terrible accident that we've experienced. We want things to change so that other families can have these beautiful experiences doing amazing things with their children.
And Clausen is also calling for speed limits to be introduced in that waterway. And yes, it is pretty gray and rainy outside today, but summer is here. And whether you're hiking, you're paddleboarding, or camping, your best adventure buddy might be a dog. And a certified dog trainer told the Early Edition this morning that it's important to know your dog's endurance levels before taking them on a big hike.
People are often surprised that their dogs actually may not have the same level of endurance that they do for things like backcountry hiking, especially when it comes to their paws, just because if they're not really used to walking on those rocky trails, for 8 hours in a day, they can actually get paw injuries really easily. So kind of trying to think of conditioning your dog a little bit before bigger adventures.
And if the plan is to go by the ocean or to go by a lake, she says make sure your dog has a flotation device on in case they don't know how to swim. So some tips there to adventure with your canine friends this summer. And that's what we have for you so far. You're watching CBC News BC. I'm Benit Brach. Coming up next is BC Today.
Good afternoon, and thank you for joining us. The death of an 11-year-old Vancouver Island boy who died after seeking emergency care has renewed calls for drastic improvements to our healthcare system and better pediatric care. We'll speak with the Vancouver Island MLA about what needs to change. And with the condo market uncertain, we've got two experts joining us in our second half to answer any questions you might have about the real estate landscape in BC. I'm Amy Bell, in for Michelle Elliott, and this is BC Today. Thanks so much for joining us on radio, TV, and live stream. You can call us now on our top story, what improvements can be made to pediatric care in BC? Our number is 604-669-3733. You can also call us at 1-800-825-5950 or hit pound 690 if it's safe to do so. Email us bctoday@cbc.ca or comment on our TikTok Live. We can be found at CBC British Columbia. In November of 2024, 11-year-old Brayden Robbins visited the North Island Hospital Emergency Department twice within the same week. On his second visit, it was apparent that something was seriously wrong. He was in severe pain, and he was screaming in agony. After 5 hours, Brayden received a CT scan, but by that time, he had already fallen into a coma. No Arab ambulance was available to transport him to BC Children's Hospital of Vancouver, and Brayden tragically died soon after from a brain hemorrhage. Devastated by the loss of their son, Brayden's parents, his mother, a registered nurse, met with conservative rural health critic Brennan. They submitted a letter yesterday to BC Health Minister Josie Osborne outlining a series of recommended actions aimed at preventing similar tragedies in the future. And for more on this, we're actually joined by BC Health Minister Josie Osborne now. Good afternoon, Minister.
Hi, Amy. Thank you so much for having me on.
Thanks so much for taking time with us. Have you spoken with Brayden's parents yourself?
I'll be doing that later today, and this is just absolutely a heartbreaking story.
Yeah.
My heart goes out to Brayden's family, his friends, his parents, and no parent should ever have to suffer the loss of a child. And I really want to thank Brayden's parents for speaking up and sharing about their loss and what they've experienced. This is an incredibly serious matter, one that everybody does take incredibly seriously, and it's absolutely critical that we all learn from this case, and Brayden's parents' story is part of that learning from that case.
Minister, I'm curious what stood out to you the most, just about the letter. In it, Brayden's parents, Nikki and Marty, clearly incredibly emotional and just devastated by the loss of their son. And they, at one point, state, "We're heartbroken beyond words and carry with us an outrage that no parent should ever feel." Hard to imagine how it feels to have a child die and to feel that the system in place to keep them and help them keep them safe failed them.
Well, they have every right to be outraged, and I join them in their determination that we learn from this to do everything possible, take every action that we can to avoid a family from having to experience anything like this in the future. That's why the multi-agency review that is underway now is a critical part of that learning and understanding what the findings are, what actions can be recommended out of this. I would note that even before the review is finished, that one important change has already been made, and that is the addition of a nighttime critical care paramedic who will be on shift to assist with this. When you go to the emergency room, you obviously expect the very best care and that everybody does their very utmost. Mm-hmm. And in this case, we know this outcome is just tragic, and that's why it's so important we get to the root of things, that this review takes place. I know Island Health is deeply committed to that review. It is my expectation, and I've made it clear, that Brayden's parents' experience, that their perspectives be a part of that review, and that Island Health will follow up with them, most importantly, to share what's been learned and what actions are going to be taken.
And that is what I was going to ask you, just if there had been any changes or improvements since Brayden's death in November of last year. In terms of timeline, How soon do we think we could see perhaps even more improvements after the investigation?
Well, the review is underway right now. And again, not waiting for the completion of that to take this first important step around patient transfer and around having a critical paramedic who is on night shift. So that's an important step. And we'll wait to see what the outcome of the review is to determine what other actions can be taken. Because again, this is about doing everything possible to make sure that a family would never have to experience what Nikki and Marty are experiencing right now.
Minister, I really appreciate you taking time with us. Thank you so much.
Thanks so much for having me on.
That's BC Health Minister Josie Osborne, and we reached her in Victoria. And we're asking you, what improvements can we make to pediatric care in the province? And has health care improved or declined in your area in recent months or years? Call us at 1-800-825-5950, 604-669-3733, pound 690 on your cell phone. You can email bctoday@cbc.ca. We also, of course, would love if you could share any stories you have with trying to access care for your children. Now, for more on this, we're joined by Brennan Day. He is the BC Conservative Party MLA for Courtney Comox and the official Rural Health Opposition critic. Thank you so much for joining us.
No problem, Karen.
Brennan, what is your reaction to what Minister Osborne had to say now?
Well, we hear this every time we see a case like this come out with thoughts and prayers and best wishes. But what ends up happening, and in this case, we're looking at conducting another internal review. We've seen how those have played out. There's a recent review out that was conducted along with BC EHS into the McIntyre-Starko case. And it's clear that it leaves a lot of room for improvement. We need to be looking to outside experts to deal with our healthcare system, but what it seems like we're doing in BC is looking to the very people that are part of the problem to review the failures in the system.
So you would like to see an outside investigation or review conducted by somebody not involved in the healthcare sector or even perhaps the government?
Absolutely. How do we get honest answers if we know that nurses and doctors are being silenced? They're not able to speak freely in these cases. They've certainly reached out to me on this case to express their concern over the state of healthcare in BC. We need to make sure that those voices are put at the forefront, that they're heard, and we need to make sure that they're not going to face professional repercussions for identifying flaws in the system. We'll never be able to fix healthcare in BC unless we start listening to the frontline workers first.
And you spoke at length with the parents of Brayden Robbins. They reached out to you in the aftermath of this tragedy. From what you've learned, what exactly went wrong in the pediatric healthcare system on November 19th, 2024 on Vancouver Island when Brayden tragically passed away?
Well, there was cascading failures, and I think that's what we really need to emphasize through this case. It wasn't just one issue, several issues lined up, and the ultimate result was when they finally determined that it was required that he seek treatment in a primary care center. The helicopter was grounded and they weren't able to get him out in time. At any point prior to that, had it been identified, there would have been time to get him to a place where the necessary surgery could have happened. And again, this isn't putting it on the nurses and the doctors on the front line. When they're looking at patient ratios, 20 to 1, 30 to 1, I've heard from nurses here on the North Island, it is impossible to place the blame on the healthcare workers that are working 12-hour shifts straight with no breaks,
Right.
and expecting them to be using their best judgment and not missing things.
Then how do we put a system in place that not only is protecting the patients, but also protecting the healthcare workers?
Well, certainly in the case of Nikki, in this specific case with Brayden, there was a lot of advocacy done by the family who knew the history of the child, and it was communicated to staff, but they weren't listened to throughout that process. So there's a major shift in culture there that needs to happen in the ERs, I think across the healthcare system. We need to stop looking at protecting the system and start putting the patients first. And it seems a lot of effort is put into protecting a system that is clearly broken at the moment, and not enough pressure is being put on in the right places, which is making sure that patients, nurses, doctors are the primary caregivers. They know what's going on with their bodies, with their children's bodies, and the nurses and doctors need that flexibility. They need to be empowered to be able to speak up, to stop the line protocols when they see something, without fear that they're going to face professional repercussions. And we've seen far too often in BC that that's happening.
We just got an email in that I'm wanting to read from Alfred, and he writes, "It's heartbreaking to hear of a child's death, especially one that was possibly preventable, and it is worthwhile reviewing pediatric care to see what we can learn, but literally everyone you know has a story to tell about medical errors. There are funny ones about a hospital that loses a patient's clothes and annoying ones, but there are those about someone who bled to death unnoticed in the emergency room, and personal ones about a child who broke their ankle and had the wrong one x-rayed. Medical errors are so common that we actually have a BC Health Quality Working Group, but clearly it needs more influence and more public visibility." I think Alfred is trying to highlight the idea that we have so many stories about healthcare breaking down in so many ways. Some of them, yes, can be very common, perhaps even comical at times, but then we have ones that lead to serious issues and even death. So, we've known this has been going on for so long. We've been hearing these cries to help the broken healthcare system for years. Now, I know you sent your letter to Minister Osborne calling for urgent systemic reform. I'm hoping you can tell us some of the recommendations that you called for to specifically address delays in emergency treatment for children.
So I just want to preface, the recommendations came directly from Nikki, Brayden's mother, and she's a nurse of 25 years. She's worked in patient quality care and also a nursing instructor at North Island College. So these come from a place of deep clinical knowledge. So when the suggestions she's made, there's some that are simple, which is just reinforcing already available protocols, ensuring that pediatric training is available and has happened for the nurses on floors and ERs across the province. And some of them get into even more minuscule, but potentially fatal, as we saw in this case. Like, when do they pull the trigger on moving somebody by air ambulance to a facility that can facilitate them? And in this case, there was no pediatrician on call in that evening, and the call was made far too late that they weren't capable of handling the severity of that case. This isn't an isolated event. We know that patient transport to primary care facilities across this province have led to deaths due to lack of transportation. Either the helicopters are unavailable or lack of transportation staff to man those helicopters. It's one thing to park a helicopter at $4 million a quarter, but if there's no transport team available through BC EHS to man that helicopter, it's a sunk cost. But as we move to a more centralized healthcare model, as it seems we're doing under this government, we need to ensure that rural British Columbians can get to that care fast and efficiently. And we need to start prioritizing that across BC.
And the differences of resources and needs for rural and urban areas, how large is that disparity in your opinion?
The disparity now in British Columbia is massive. You are getting a second-rate healthcare in BC if you don't live in one of the major urban centers. And unfortunately, we've even seen it now in Kelowna, where if you're not in Vancouver or Victoria or potentially Prince George, you may not get a standard of care that you're getting in one of those centers across BC. It's not the small regional hospitals. Comox Valley Hospital is considered sort of a mid-sized hospital. So,
all right, we've got a few calls that have come in I'd like to get to. From Alana in Creston. Hi, Alana.
Hi. Hi there.
Hi, and what is your experience with perhaps pediatric care or healthcare in general in BC?
Yeah, so specifically in Creston, my daughter's now 20 months old, and it was extremely difficult to get in with the midwife here in Creston. And, some of my friends have been turned away. They were hoping for midwifery care. turned away and then so had to seek midwifery care in either Nelson or Cranbrook, and were traveling, over the Creston Salmo Summit in the winter time for appointments, and then if they went into labor, had to drive, an hour and a half to be cared for by a midwife or an OB.
That I can't imagine, as somebody that was lucky enough to be pregnant and give birth in Vancouver with very close access to all prenatal care. When you look at pediatric care, it starts in utero. This is when the care starts, and that we're seeing in rural areas, we do not have adequate help for people.
I just wanted to say, too, that when I was pregnant, I had a midwife and I had intended on having a home birth. Mm-hmm. And they said, well, if you go into labor and there's nobody here in Creston, and there's an emergency, you either have to go to Creston or to Cranbrook or Nelson. So it's scary when it's, your first child born and you don't know what to expect, but then also knowing, there's no actual OB, like they don't work on the weekends or something, or,
right.
There's no coverage. So then you're, in case of emergency, you have to travel and, over a huge summit or, so.
Yeah. And
I think that, yeah.
I really thank you for sharing that with us. And obviously, depending, Brennan, I can see you nodding, depending on, I would imagine, time of day, time of year, driving conditions, whether there is an ambulance on hand. These are all just clues to those massive gaps that people are facing and trying to plan around. But it's when the emergencies happen, there's nothing.
And it's not just the availability of emergency care or ambulances we saw last week in the case of Smithers that doesn't have coverage currently. Mm-hmm. It's the cost for rural residents to access care when it's being centralized. I mean, I went through it with my wife in 2017. She had pregnancy complications, and we needed to be within 5 minutes of a primary care facility down in Victoria for 3 months.
Yeah.
And the cost... That's only 2.5 hours from my door. Anybody that has to stay in Vancouver and has booked a hotel recently understands what that looks like. It can bankrupt a family to access care in British Columbia.
It would be thousands of dollars.
Thousands or tens of thousands of dollars in some cases. The average right now, but the Rural Health Network put out a publication, it's averaging $3,000 now for rural British Columbia access health care. That's unsustainable long term, and it's turning rural British Columbia into second-class citizens in this province.
I do have time for at least one more call. We'll go to Val in West Vancouver. Hi, Val.
Hi, yes. Can you hear me?
Yes, I can. Thanks for calling in.
Oh, good. Oh, sorry about this. There we are. A bunch of things. Our file, when our daughter died in 2020, is file 118 with the College of Physicians, and they haven't been able to do anything but nothing found in the facts of the file. The important thing to me is the transparency of what took place so it doesn't happen again. I've gone at them over and over and said transparency is important. Since nothing is found, it's a very high bar. Mm-hmm. So first of all, patient quality care is where you go when somebody dies. Mm-hmm. And they pat you on the head and they say, really sorry that something went wrong. Nice to hear from you. And they can't do anything. In fact, the lady at patient quality care said, I don't tell them what to do. They tell me what to do, because I said, can you hand this information on so there will be better psychiatric care for my child? People, similar situation. Okay, so that's one, and that files get old. The Health Professions Review Board said it was inadequate. When I asked that 8 doctors be looked into, and only one was, in their final report, nothing found. And major urban centers, well, that's not what's helping or not helping. Is because we're in a major urban center, and she still died in a building. Like 3 people died, April, October, December. And then the 12-hour shifts, there should never be 12-hour shifts. I'm sorry. Say the health professionals think it's important to work 12 hours. You're not making good decisions by hour 9, 10, 11. It should be illegal for health professionals with so much going on. They should not be allowed, no matter that the union demands it.
Yeah.
And stewards of all of these things are physicians. So what are physicians going to say? They're going to say nothing found. And public transparency is the most important thing. So that, 1, 2, 3 patients, then I met more people, 4 or 5, they died. And there's still, the stewards of all of this are the people who are actually making mistakes. And so my investment in this file has been thousands of hours, and yet the College of Physicians pretends that they're trying to make things accessible for people who find complaining inaccessible. Well, if my number one complaint has nothing to do with personal stuff, just saying make mistakes transparent so they do not happen again. They all stand as education.
Val, I will have to end our conversation there. Unfortunately, we were just about out of time. I just want to give Brennan a chance to respond. That transparency, I could see you are very much in agreement that a lot of these things that come up that are complained about, we don't hear about.
We don't hear about them because the people speaking up on them are being censored, and they're stuck in a cone of silence. Frontline workers do not feel comfortable in the BC health system speaking up. When they do and go through the correct channels, it goes nowhere. We cannot rely on internal investigative bodies at this point. The number of nurses and doctors across the province that have reached out to me with serious complaints, they've gone through the system, they've made the formal complaints, expected changes, minor changes that would make a huge impact on the front lines, and they're not being listened to. We've got to stop protecting a system for the sake of protecting the system and start putting frontline nurses and doctors' voices first.
Brennan, we have to leave it there. I'm straight out of time, but I really appreciate you sticking with us, and we'll talk again about the case involving Brayden.
Thank you very much.
That was Brennan Day joining us from Courtenay on Vancouver Island. It is 12:28. And this is BC Today. Yesterday, we spoke about living with chronic pain, and so many of you wrote in to share your experiences. Maureen wrote, I've been dealing with chronic pain for almost 40 years. I just arrived home from a session to hear the topic of chronic pain on BC Today. The physiotherapist gave me some advice and exercises, all aimed at getting my right leg working. My symptoms are very similar to those of your first caller. The leg looks fine, but it doesn't know how to function as a leg. It feels like a large hunk of concrete that I'm dragging around. I had several treatments at the Kelowna Chronic Pain Clinic, but stopped after they told me I would not be covered for insurance liability if I drove my car home. That was back when I could still drive my car. I live in Oliver, so the loss of my ability to drive has been a game changer. I have arranged a ride for every treatment that is not in Oliver. My life has become smaller. I only go out to buy groceries or supplies at the pharmacy or gummies unless I'm invited somewhere and a ride is provided. Chronic pain has changed my life, and it continues to change after almost 40 years. And Andrea said, my concern about dealing with chronic pain is that many Canadians no longer have a GP, family doctor, to prescribe the necessary medications. I have a complex illness due to a brain tumor that led to a bunch of problems. I was being treated by my GP with a narcotic pain med. Then he retired, and I have no family doctor. The ER, phone doctors, and walk-in clinics will not prescribe narcotics. I get treated as an addict trying to get a fix, when in reality, it's the only treatment I've ever had that was working, and I cannot access it. You hear all about why narcotics are bad, but it's worth remembering some patients really need them for treatment of pain. Thank you again to everyone who shared their stories with us. This is BC Today on CBC Radio 1, and it is time now for the CBC News to 12:30 with Robert Zimmerman.
Good afternoon. The BC Wildfire Service says there will no longer be any so-called wildfires of note in the province after a fire burning north of Lytton loses that classification today. It says the Eisman Creek blaze is now classified as being held, which means it is no longer likely to spread. The service credits that change to the work by firefighters with the help of favorable weather conditions. Police are looking for a man who may have tampered with beverages at restaurants and bars in downtown Kamloops. police. At least 4 people reported symptoms of being drugged over a 5-day period last month. One victim noticed an unusual taste in their drink and reduced alertness after talking with an unknown man. Kamloops RCMP are scanning surveillance footage to identify a suspect. And the Vancouver Art Gallery is slashing about 30% of its programming and staff as it tries to balance its budget. 16 staff members accepted voluntary buyouts last month, and 18 others have since received layoff notices. The cuts will not have an impact on the plan to build a new home for the gallery in downtown Vancouver. And now the forecast on the North Coast, clearing this afternoon with a high of 15. Highs reaching 19 with lots of sunshine and strong winds in the Peace. In the central interior, including Prince George, mainly sunny with a high of 18 degrees. Highs getting close to 30 with strong winds and a chance of thunderstorms in the Kootenays. In the southern interior, including Kelowna, a high of 25 with showers and a risk of thunderstorms. And a chance of showers in Metro Vancouver and the Fraser Valley this afternoon. Clearing in Greater Victoria with highs around 19. That's your CBC News update from Vancouver.
Thank you very much, Robert. I know you don't have a dog, but do you ever travel with your cat?
I do not.
Okay.
No, seems like a huge hassle.
Kind of like traveling with your kids sometimes, but
That's
it's all
true.
worth it.
No litter box with the kids.
That's true. That is very true. All right. Thank you for that, Robert.
Sure.
Because it may not seem like it today, but we're in the middle of summer, and it's a good season for outdoorsy types who like to paddleboard and camp and hike and swim and many other summer activities. And if you're a dog owner, it's even better. If you like adventuring with your furry companion, wagging their tail by your side, dog trainer Lynn Gagnon has some advice and gave it to the early edition this morning.
Trying to think of conditioning your dog a little bit before bigger adventures, maybe starting with some shorter hikes if you're going to go hiking. For water sports, not all dogs know how to swim. So as much as that's usually the experience, we're like, oh, they just know, but that is not actually the case. Some dogs unfortunately do drown. So being ready with safety devices like a flotation device and a tether that's long enough because you can, especially with a bigger dog, if they're tied to your paddleboard, for example, and they decide to jump off, they can flip you off of the board as well. So.
Okay. And if you're camping, I would think it's pretty obvious to have the dog in the tent with you if you're tent camping, yes?
Yes, definitely. That is the better choice. We need to manage our animals when we're in the forested environment. That environment is not ours, right? So we don't want our dogs like chasing after critters at night, also just disappearing on us. And so some of the tips, actually, one of my biggest tips, especially if you're backcountry camping, is getting some little socks for your dogs because those nails can be pretty sharp and it is really easy for them to poke a hole into your sleeping.
Well, after years of soaring prices and new builds, Metro Vancouver's condo market is showing signs of strain with projects stalling and sales declining and developers hitting pause. With uncertainties on the rise, a lot of us are left with questions and concerns. So what does this shift mean for the future of BC's housing market? What does it mean for you? Now is your chance this afternoon to ask us anything you want to know about the condo market. You don't have to take it from me. We've brought together both a real estate expert and an expert mortgage broker to answer any burning questions, big or small, that you have. Call us now at 1-800-825-5950, 604-669-3733, pound 690 on your cell phone. You can email bctoday@cbc.ca or comment on our TikTok live at CBC British Columbia. Joining us now is Jennifer Kuan, Senior Partner at Clear Trust Signature Mortgages, and Ben Kay, a Realtor at McDonald Realty Limited. Good afternoon to you both.
Hi, good afternoon.
Thanks so much for coming in. I'm sure you get a lot of questions from friends and family, but we're going to let the audience pick your brains today. I will start with you, Jessica. With rates with rate drops from banks, from a mortgage perspective, what are, I would suppose, the biggest hesitations that some buyers are seeing entering the market?
Yeah, even with rate drops that we've seen a lot of the hesitation from buyers. And I think the biggest hesitation is the fear of overpaying for a home. I think that buyers are concerned that, or think that maybe prices might drop further in the future, and they're scared about, whether it's the right time to buy. And I think buyers are hopeful that they can wait for interest rates to come down lower and prices to fall and to basically hit the bottom.
And Ben, what are you hearing in terms of sort of like questions or concerns that are coming from your clients, or people that are looking into either buying or selling a condo?
Yeah, absolutely. I mean, as you can imagine, hot topic of Vancouver when it comes to real estate.
I mean, any day it's a hot topic. It's weather or real estate. Those are our
Yes,
two big
sure,
things. But
sure.
we've had it in the news so much about the condo market. How are people feeling?
So to that end, we're working a lot through clearing through the noise. And if you're looking to buy, we're dealing with a lot of uncertainty, a lot of buyers trying to predict what's going to happen. And obviously, no one has a crystal ball. All we can do is look to what we know of previous experiences that may have had similarities. And for sellers, it's really about trying to understand what some of those expectations might have to be. And they can no longer be what they were, say, 6 months ago. Maybe we have to look a little bit further out. And at the end of the day, just making the right decisions that are going to be good long-term decisions, not just today decisions.
Well, and I think that is always difficult for people in that, either buying or selling is immediately what's best, is not always long-term what's best. And some people can't wait for the long-term, so they have to reevaluate their expectations. We actually had a question already come in from Steve, and he says the decline in condo values has been in the news a lot, but now I'm wondering, are single-family homes values soon to follow? What are your thoughts on that?
Sure, yeah. I mean, really a great way for us to understand the health of the market is just look at how much is turning over. So in the condo market, we're right now on the cusp of a buyer's market, about 14% turning over across Metro Vancouver. For detached homes, that rate's a little bit lower. Some are just under 10%, so hovering around that single digit. And if we stay in a sustained period of time where demand is at that rate, then that would lend itself towards prices starting to decline. But I think what's really important to remember is what the realistic expectations are of where prices are today versus where they've been. Yes, they're down, but if you look at sort of average selling prices, they're within 1% to 3% of asking prices. And it's not like they've fallen off of a cliff, which again is clearing through that noise that we want to make sure clients are understanding where to set their expectations.
Right. And Jessica, what sort of conversations are you having with clients? As Ben said, we hear this noise, there might generate a bit of panic. What are you talking about your clients with as you walk them through buying and selling, I suppose?
Yeah, I think a lot of our topics with clients is, of course, interest rates. But it's now not always about what is the lowest interest rate. It's about what is the right term that will fit with your values. Do you value stability? Do you want flexibility? What are your future plans? And it's not just about what is the lowest rate that we can get you into, but how long do you see yourself living in this property? What is the cost to get out of this mortgage if things change? 60% of homeowners in Canada typically break their 5-year fixed mortgage. And we want our clients to understand how much is it going to cost them to get out of the mortgage, not just what is the interest rate today that they are going to sign on.
Okay. And again, it's that sort of short term versus long term. And with any real estate deal, I think people are always surprised with how much money is sort of dispersed to all different aspects and needs to be sort of looked at holistically in terms of mortgage and fees and long and short term plans. Ben, Ann McMullen, who is the CEO of the Urban Development Institute, did speak to the CBC about the condo market and said, quote, "It's not just that the industry is struggling, it's our inability to deliver homes that people can afford." Do you feel that's a valid statement?
Sure, yeah, I do.
Okay.
I do believe it's a valid statement. At the end of the day, we have to build housing that's going to work for local demand and for the need that is within the market that we're in. But I do think strides have been taken over the past few years to start shifting where those housing starts come from. You've seen a lot of very high-end, ultra-luxury product being built, coming online. But I think that shift is now being peeled back a little bit towards building more family-oriented housing. And then with some of the programs that have changed on the legislative level in BC that allows for more of that type of family-oriented housing to be built, things like the small-scale housing legislation and the transit-oriented developments that have come about in the past couple of years.
And I'll ask you both, like in terms of somebody who has perhaps gotten a mortgage to, buy a condo before like a pre-sale.
Yes.
If they are feeling like they are not going to be able to now afford it, or if they are buying it for a investment and they do want to sell it now, what sort of information or conversations are you having with them? Jessica, have you been in that situation or have colleagues that have?
Yeah, we definitely have seen clients with concerns about completing on their pre-sale, purchased a few years ago, and now, financial situation has changed. So a lot of our conversations are just trying to figure out different solutions for them, right? Maybe what they had expected when they had purchased that pre-sale, it's completely different now. Maybe we do need additional down payment, maybe a cosigner on the application, ways to essentially keep that home, keep that deposit. And then in the worst case, it's okay, if we were to sell this home, what would that look like as well? Yeah.
Okay. And we would love to have people call in our conversation. Ask us anything you want to know about condos. If you have an experience either buying or selling a condo now or in the past, we'd love to hear from you. Call us at 1-800-825-5950, 604-669-3733. You can email us, bctoday@cbc.ca. And we're joined by two guests, Ben Kay, a realtor with McDonald Realty, and Jennifer Kuan, a senior partner at Clear Trust Signature Mortgages. And they're here to answer your questions. You can pick their brain. You won't even have to pay them for this one. But I do want to ask you, Ben, how did we sort of get in this position where we look out in the skyline, we see all of these glass high-rises, all of these condos, and now we're hearing that, people can't afford them or they're not being able to be rented out. But we also have people saying there's not enough housing for people, affordable housing.
Yeah.
How do we sort of reconcile those two in this city?
It's confusing, isn't it? There's just so many different angles.
Yeah.
We're in a place where it's almost like a perfect storm of events that come together, right? I think last year a lot of consumers were waiting for interest rates to sort of finish their decline. And the expectation this year was that that was going to be perhaps a landing spot for us. And then, of course, the world order has changed a little bit with geopolitical events, the trade war, and that has created a pause in demand. There was a buildup of supply because a lot of investors sort of strayed away from the market. That demand is still there. Buyers still want to purchase these homes. They're just not acting right now. And I think that's why we're seeing that glutton of supply that you might be referencing.
Just a lot of wait and see because it's been hard to predict what's been going on. And, we know that the Trump administration in the U.S. has impacted so many aspects of life here in Canada. Has it had a massive impact on real estate industries?
Yeah, and it's hard to pinpoint specifically if that is the reason, but I can, in my own opinion, it is certainly a major factor in the uncertainty that we're feeling right now. If you look at the uncertainty index right now, it is, 3 times higher where it was pre-election down south. That has an impact on all kinds of markets, real estate being one of them. And, real estate is in Vancouver an interesting market because it's not just black and white. It also acts a lot on emotion. People make decisions based on what feels comfortable and safe. And amidst a lot of uncertainty, it's hard to do so.
Well, and in the past, too, we saw a lot of people making decisions perhaps in a rush because they felt if they didn't act on a property immediately, they would get outbid. So they perhaps would not get an inspection, not get a place that they truly wanted, or perhaps, agree to mortgage terms that weren't ideal for their situation. Are we at least, I guess, to silver lining it, seeing people with sort of cooler heads prevailing and not getting in these situations as much?
I definitely see that. I think people are they've learned from the past and they're taking their time more. And we see a lot of our borrowers too, they're asking a lot more questions. They really want to understand every piece of their mortgage detail, which is great because the more you know, the better decision you can make. And that's why I would say, like, even our clients, not everyone's just coming to us saying, hey, I want a 5-year fixed mortgage. They really want to understand, what are my options and why might that option be the best for me based on current situation and what I think I will do for the future.
And how do you sort of, I know things wax and wane, but when you're sort of talking to a client about mortgage possibilities, I know we're a long way from, the mortgage interest rates that we had 5 years ago, so things change quite quickly. But are there certain terms that you are finding yourself recommending more now, or certain terms that you're finding clients asking about more now?
It definitely depends on the individual. I think one thing that we really encourage our clients to think about is how much stability do they need and for how long. I would say there's a handful of our clients that are taking on 3-year fixed rates. Even though headlines have shown that we are expecting perhaps variable rates still might come down, but clients are valuing peace of mind. They want fixed rates for predictability, for stability. And I think right now, the value of knowing what they are going to be paying is outweighing further rate drops.
Right.
And why a 3-year term? They want the stability for the short period, but they also want the flexibility of being able to renew in the shorter term and reevaluate their situation at that time.
Not to be locked into something long term. And I think we all have that friend or neighbor who had a variable rate and inevitably somehow found themselves very quickly paying far more than they ever expected. And it does lead you to make some sort of fear-based decisions. We do have a call that's come in from Patrick in Vancouver. Hi, Patrick. Thanks for calling BC Today.
Hey, thanks for taking my call.
So what questions do you have about the condo market?
So I'm actually a first-time home buyer, and oddly enough, I will be taking possession tomorrow.
Oh, congratulations.
Yeah, maybe your guest can help calm my nerves a little bit, too, because it's pretty nerve-wracking doing this whole thing by myself. But basically my question is, I know that they increased the amount for first-time home buyers to be tax-exempt. Obviously, there was nothing really affordable at the price they had previously, and now they've increased it. But I've kind of fallen into this time frame where I don't qualify for it, so I don't know if it's going to be made retroactive or not, or if there's anything I can do to apply for some sort of rebate or tax credit.
All right. Thank you for that. That's obviously above my pay grade, so I will leave that to my experts.
Jessica.
Yeah. Patrick, can I ask you a couple questions? Are you talking about the property transfer tax exemption, or are you talking about the GST rebate?
I was talking about the GST rebate, but if there's another one I should be aware of, please let me know.
Right, all the taxes. Okay, for the GST rebate, it's if you purchase the pre-sale and you entered into the contract, I believe the date is prior to May 27th, 2025. Is that correct?
Yeah.
Yeah. Unfortunately, yes, you do actually still need to pay that GST. I understand there might be a petition kind of going around in hopes that the government will consider rebating for any contract or any closings after May 27th. But as of right now, from what we know, any contract that's been dated since before May 27th, 2025, GST is applicable.
All right, Patrick. Okay. I hope that helped you out. And again, good luck and congratulations on the new place. We had a comment come in on our TikTok from Kool-Aid Grape. I always have to just make sure I can read their name out loud before I say it. It says, rate drops. I was told it's steady right now. Is a rate drop since the beginning of the year?
Yes, rates have been steady for the last few months. And quite honestly, even for July, we have another rate decision on July 30th. Mm-hmm. And right now, I think that what we're anticipating is probably another rate hold. So rates have been really steady. We've seen some small fluctuations where banks have offered some really good rate exceptions. It really just depends on where the bond yields sit that day as well, because fixed rates are heavily affected by the bond yields on a daily basis.
Okay. Ben, we used to, I think a lot of people used to consider condos, if they could afford it, to be a very wise investment, either for their children, either for rental opportunities. Do you still consider it to be a good investment, in BC, but especially in Vancouver?
Yeah, I mean, it depends on what your investment criteria are, but generally, yes, it is. The first perspective I often speak to with my clients is, okay, if it's a primary residence, it's also an investment, right? We're building equity, we're building housing security for our future. Interesting, a lot of the conversations I've had with some of my investor clients recently have shifted perhaps from, a speculative approach, which is never a safe approach in any investment type, to security for another loved one, right? So I'm seeing a lot of parents who are purchasing a secondary property for a child who might be even as early as in grade school right now.
Wow.
And wanting to have a future for their child in their city.
Yeah.
So generally, yes, the fundamentals are still steady. And if you're looking at the type of housing that's being built, I do believe there's always going to be a demand for housing in our city. That's the reality of it. So we have to have a longer term approach when we're thinking about investment. We can't just look to make decisions informed by the present market right now. We have to think about what that future looks like.
And in terms of buying, perhaps an investment for your children, I had a colleague say that they heard an ad, I think, for a condo build in Clayton area of Surrey. Okay. And that's how they were advertising it, buy a condo for your children. And that was the first either of us had ever heard that approach.
Interesting.
But, it is so difficult to think of your children being able to afford, say, in Vancouver, and the lack of affordable housing. I can see a lot of parents turning to that.
Yeah.
We do have another call that's come in from Micah in Vancouver. Hi, Micah. What's your question for today?
Hi there. So in looking at the real estate market, I noticed that there's a lot of vacant land for a lot cheaper than, land with housing on it. And I'm just wondering if your experts could talk about how possible it is to get a mortgage for vacant land, because I've heard that it's a lot trickier.
Yeah, I mean, short of just putting a tent up, you've got to do something with the land if you want to live there.
Micah, that's a really good question. So with vacant land, yes, it can be more challenging because in the bank's mind, they want to understand what are your plans with the piece of land. No one wants to really lend on a piece of land and not have a house on it, right? And so most of the time when we're looking at land financing, you're typically looking at 65% loan to value, maybe sometimes up to 75% loan to value. So what that means is you're looking at having to put about 25 to 35% down payment. On top of that, of course, again, banks want to know, are you planning to construct on the property? And if you do, what are the plans? Do you have the blueprints? Who's your team that you're working with? How experienced are you? So it can be challenging. I would say that definitely, chat with a mortgage broker or mortgage specialist, and they'll be able to kind of help guide you on what the requirements are to help you with the financing.
Okay. Does that answer your question there, Micah?
That does. Thank
Great.
you so much. I appreciate it.
No worries. Thank you for that. We did get an email that just came in from Claire, and it says, "Hi, my son lives in the States, and he just bought a house. He has a 30-year mortgage with a 30-year term. Why do we have to renegotiate a mortgage every 3 or 5 years in Canada?" Thanks. I'm going to let you both weigh in on this, perhaps.
Yeah, I mean, I wonder the same. I've got cousins who are just visiting right now actually from the U.S., and we had a similar conversation
I'm like,
before.
wow.
I think, Jessica, you probably can handle more of the rules around this.
Yeah, I mean, it would be amazing. And we've seen it with in the States where you get the same rate for 30 years. And with us, it's always, we have to renew.
Yeah.
And it's because, with our banks, they have to look at their balance sheet and where rates are at that time in terms of Bank of Canada's prime interest rate, Bank of Canada's overnight lending rate, where yields are at too. And that's why our rates we have terms. I would say the maximum term in Canada that you can find is actually 10 years, which is the longest. Before, the most we saw was 5 years. But I would say that most of the time right now, we do see most clients will only go up to 5 years. And it is because I think in our day and age, a lot of clients do purchase upsize, and we are usually moving around as well. So after 5 years, mortgages tend to be broken, and then people are moving or porting their loan.
Okay. Ben, we're running out of time, but I want to make sure to ask you this. Where do you see the future of the condo market, both short and long term, in BC, and especially, of course, in Vancouver?
I think that, right now is certainly a window of opportunity, especially for first-time home buyers. We spoke earlier about the pace of the market. And if you look to, again, all we can do is look at the past. Look at the past 10 years, only 3 of those years have been buyer markets. This is one of them.
Yeah.
So I do think that there is a lot of upside to the market. And speaking my own experience, what I can see on both my listing client and buyer client sides is that there's a lot of interest and even motivation to transact. There's just that fear right now that's holding people back. And at a certain point, like we've seen in previous crises, that fear will subside and will turn around. So I do think that there is a recovery to come. And if you're able to make, smart, at least medium term, ideally long-term decisions right now might just be that right time.
All right. And in terms of sort of feeling that fear, final minute, do we need to stop being so emotional when it comes to our decisions about real estate? What do you think?
I think calm minds can always prevail. And you ask 100 people their opinions, you'll get 100
That's very
opinions.
diplomatic.
You got 2 of those today. But, I think it's just really important to, at the end of the day, assess what's most important to you, get the education you need.
What do you think?
I think it's possible, but I think with buying anything, there's always going to be some emotion involved.
Fair enough, especially where you might spend the rest of your
Exactly.
life. I want to thank you both so much for coming in today. That was fun. That is Jessica Kuan, Senior Partner at Clear Trust Signature Mortgages, and Ben Kay, Realtor at McDonald Realty Limited. And that is our show for today. Thanks for calling and joining the discussion.